All right, so Rapp, that's an intervention for what target population?
Well, Rapp stands for the Real AIDS Prevention Project, and it targets heterosexual women of childbearing age. So we know it has been proven effective with Latina and African American women.
Is that an intervention that can be used in rural or urban settings or both?
It can be adapted to any community as long as it's disseminated within a community, because Rapp is a community-level intervention that has several components within that intervention. But the focus of the intervention is to basically target the community at large, and within that specifically finding ways to reach Latina and African American women or women in general who are at risk for HIV transmission.
How does the intervention go about targeting these women and setting up effective behavior change?
Well, there's different components to Rapp, and you have your peer networkers, are those individuals who are from within the community. Those are women or men sometimes also that resemble and or are part of that community, and they become basically those individuals who disseminate the information about Rapp. We also have role model stories, and those stories are based on individuals' experiences on how that particular woman was able to change her behavior based on the stages of change theory, and looking at where she's in within the beginning of sort of the story, and then at the end moving that individual from one place to the other. So it's basically staging the community, and then you disseminate sort of those role model stories. You have your community networkers, and those are your businesses, your organization, your churches, your leaders, anyone that can really support Rapp by providing you space, by inviting you to health fairs, maybe giving some donations to the program. And then we have stage-based encounters, and those are the encounters that you do in the community, interactions with the community, and within that you're able to assess where that individual is, and you stage them, and then based on that stage, you're able to give them a role model story. Last but not least, I think role model stories, stage-based encounters, your community networks, and then you also have small group activities. That's where you do presentations on safer sex, HIV presentations to a small group of women, and that tends to be in a small sort of confidential space where the women feel more comfortable about having discussions on, their particular sort of risk behaviors and then ways to protect themselves. Consider a group level session to a group of women, particular women who are within that community, and the goal is to basically give them as much education as possible around risk behaviors, how to negotiate condom use, how to use a condom, etc. So those would be.
Is there a certain amount of sessions that a participant has to go through to be officially completed with Rapp?
No. I mean, you would. I would assume that if a woman already participated in those, depends on how the agency decides to do maybe one group per week or 2 a month or something, and maybe the topics can be different. Maybe one is on safer sex, maybe another one on negotiating safer sex, maybe one is on HIV 101 or STDs. So the topics can vary. But I would assume that if a particular woman has participated in sort of all the sessions that the organization provides, maybe she can be considered to become a peer networker, someone who is out in the community disseminating the role model stories, or recruiting other women to the safer sex gatherings, or can begin to do stage-based encounters depending on their training and the level of expertise. But overall, I mean, women can come to the sessions as much as they like.
Okay.
And I think that's where it takes us to stage a community, because we talk about individuals and staging that individual. Well, within that you also have to stage where the community is at. And so that's where the community assessment, your formative assessment, is very important to this process, because it gives you an understanding of where the community is with regards to condom use.